anger and aggression management. While dealing with the meaning of anger and aggression, anger, it is a strong, uncomfortable emotional response to provocation, but that is unwanted and incongruent with one's values, beliefs, or rights. Aggression. It refers to behavior that is intended to cause harm or pain. While dealing with the characteristics of aggressive behavior is communicated verbally or non-verbally. Aggressive people may invade the personal space of others. They may speak loudly and with great emphasis. They usually maintain eye contact over a prolonged period of time. Gestures may be empathetic and often seem threatening. While dealing with the types of aggression, there are three types: instrumental aggressions, hostile aggression, and relational aggression. While dealing with the instrumental aggression, aggression aimed at obtaining an objective privilege or space with no deliberate intent to harm another person. In hostile aggression, this aggression intended to harm another person, such as hitting, kicking, etc. A relational aggression, a form of hostile aggression that does not damage to another peer's relationship, as in social exclusion. While dealing with the theories of aggression and violent behavior can be viewed and continued with verbal aggression at one end and physical violence at another end. While dealing with the psychological theories, one psychological view of aggressive behavior suggests the importance of predisposing developmental or life experience that limit the person's capacity to select nonviolent coping mechanism. Organic brain damages, mental retardation, or learning disability which impair the capacity to deal effectively with frustrations. While dealing with the social cultural theory, social and cultural factors may also influence aggressive behavior. Cultural norms helps to define acceptable and unacceptable means of expressing aggressive behavior and feelings. A cultural norm that supports verbally assertive expressions of anger will help people deal with anger in a healthy manner. While dealing with the biological theory, current biological research focused on main three areas of the brain believed to be in aggression: limbic system, frontal system, and hypothalamus. In limbic system, it is associated with the meditation of basic drives and the expression of human emotional and behavioral such as eating, aggression, and sexual response. In frontal lobe, this lobe plays an important role in meditating purposeful behavior and rational thinking. They are the part of the brain where reasons and emotions interact. Damage to the frontal lobes can result in impaired judgment, personality changes, and impaired decision making. In hypothalamus, it is situated at the base of the brain. It is the brain's alarm system. Stress raises the level of steroids, the hormone secreted by the adrenal gland. Nerve receptors for these hormones become less sensitive in an attempt to compensate, and hypothalamus tells the pituitary gland to release more steroids. While dealing with the predisposing factors, in biological factors, genetic plays a major role, chromosomal influence in neurotransmitters, catecholamine mechanisms to be believed in the induction and enhancement of predatory aggression, whereas serotonin and GABA seems to inhibit. Dopamine seems to facilitate aggressions. In neurophysiological disorders, epilepsy of temporal lobe and frontal lobe origin result in episodic aggressions and violent behavior. In psychological factors, according to Freud's view that all human behavior stems either directly and indirectly from the instincts. According to Lawrence's view, aggression that causes physiological harm to others springs from a fighting instinct that humans share with other organisms. In social factors, it deals with frustrations. The single most potent means of human beings to aggression is frustrations. In direct provocations, evidence indicates that physical abuse and verbal verbal tantrums from others often causes aggressive behavior. In computer games, television violence plays a major role in this. In environmental factors, air pollution, noise and crowding plays a major role. While dealing with the management, nurses provide care for patients with types of problems. Nurses who work in the settings such as emergency room, critical care areas and trauma care often care for people who respond to events with angry and aggressive behavior that can pose a significant risk to themselves, other patients and to healthcare providers. What's the role of the nurse? The first role deals with the assessment. A violence assessment tool can help the nurse to establish a therapeutic alliance with the patient, assess the patient potential for violence, prevent aggressive and violence in the milieu, notify co-workers, obtain additional security. In patient education, teaching patients about communication and the appropriate way to express anger can be one of the most successful interventions in preventive aggressive behavior. In assertive training, interpersonal frustration often escalate to aggressive behavior because patients have not mastered aggressive behaviors. Assertive behavior is a basic interpersonal skill, communicating directly with another person. Being able to state complaints, staff can provide feedback to patients' appropriateness and effectiveness on their response. While dealing with the communication strategies, present a calm appearance, speak softly, speak in a non-proactive and non-judgmental manner. Show respect to the client, avoid intense direct eye contact, listen to the client, avoid early interpretation, do not make promises that cannot keep. In environmental strategies, inpatient units that provide many productive activities reduce the chance of inappropriate patient behavior. Both the unit norms and the rewards associated such activities may reduce the amount of patient's behavior. In behavioral strategies, limit settings. Limit setting is a non-manipulative act in which patient is told what behavior is acceptable and what is not acceptable and the consequences of behavior unacceptably. By explaining the rationale for the limit and communicating to the patient in a calm and respectful manner. Time should be clarified before negative consequences are to be applied. To prevent aggression, workplace guidelines need to be explained. Analysis incidents including the characteristics of victims, prevention and control, safety and health training, staff development, staff health education program regarding risk factors that causes or contribute to assaults. Early recognition of escalating behavior or recognition of warning signs that may cause assault. Workplace violence prevention policy, policies and procedures for obtaining counseling, workers' compensation or legal. To conclude, anger is a normal human emotion that is crucial for individuals' growth. When handled appropriately and expressed assertively, anger is a positive creative force that leads to problem solving and positive change. When channelized inappropriately and expressed as verbal aggression or physical aggression, anger is destructive and potentially life-threatening force. Thank you.